Welcome to Independent RX Forum with the National Community Pharmacists Association, America's leading advocate and business education provider for independent community pharmacists. Independent RX Forum is powered by RX Connection.
Good afternoon and welcome to Independent RX Forum, the official podcast of NCPA. I'm your host, John Beckner. We're glad you could join us. So with only 1 week left before NCPA's Congressional fly-in, we thought it would be a good idea to discuss our legislative priorities that will be shared with members of Congress when our members fly into Washington on April 15th and 16th. My guest today is Kaite Krell, Director of Congressional Affairs for NCPA. Kaite, it's great to have you on.
It's great to be here.
So I would imagine this is a busy time of year for you. So why don't you share with us what you and your team are involved in the weeks leading up to fly-in?
Yeah. So right now it is a busy time because it's appropriation season. So the president has put out his budget for the year, and then Congress goes ahead, takes that budget, and they're supposed to turn it into 12 appropriations bills to fund the government. If you are familiar with Congress at all, we aren't very good at funding the government. We were able to get the majority of it passed in January, which should have started in October. So just a little bit of a heads up on like how we're doing, and not even all of last year is completely funded right now. So this is why traditionally we bring in all of the folks who are going to be asking for requests, talking to the members of Congress, so they know as they are building the budget for next year and they know what's going on, what needs to be included and what's an important priority for the year at the beginning of it. This year's been a little bit interesting, because we did pass last year's funding bill in January, but we did get some wins in there. So getting everything leading up to that and trying to get it going has been fun. We have to figure out who's going to come and speak at the fly-in. We have to figure out how many folks are coming, what offices they're going to. There's a congressional reception on Wednesday night, and so inviting members of Congress and their staff to come and just mingle with everybody in a little bit more of a relaxed setting, and just getting all of that up and rolling so that when our pharmacists are here, they can just worry about telling their member of Congress what they're doing on their day-to-day and what's important.
So with respect to our folks being here, there's really no substitute for face-to-face.
No, there isn't. And I can say this as a former staffer and as somebody who has been working with Congress or for Congress for the last decade. There is absolutely nothing more important than getting your story to your member of Congress. They come in, and I can follow up behind David, and all of the NCPA team is so good at being able to follow back up with any questions on the technical aspects. But we aren't facing patients on the day-to-day. We aren't doing the small things and knowing how it's impacting. And so having the member come in, sit down with their constituent from their district who's impacting patients in their community is huge, because you are the reason that they're there. And that's really all that they care about at the end of the day. And so I'm happy to do any of the technical things, but telling your story and getting your news across to them and how you are impacting and your community is impacting, nothing beats it. I can't tell you how many times we've had a member of Congress who hadn't really been interested in the issues or hadn't understood what was going on, does one pharmacy visit and comes back and tells us, all right, what do I need to do? How do I get involved? How do I hop on the bill? Because that's how impactful these stories and these moments with them are.
So you mentioned, this year's a little bit different. It's an opportunity to thank Congress because PBM reform did pass after years of trying. But that's not the end-all, be-all. We really need to keep the foot on the pedal, and PBM reform is ongoing.
It is ongoing. And so I think the biggest priority for us this year is to go ahead and say thank you. Thank you to Congress. Thank you to everybody who worked on it. It has been a long time going. We did get the Medicare Part D provisions across the board. We talked a little bit about that in a former podcast. But what's really exciting is there's more to come, and there's always more to come. And we got a little piece of the pie, but we have been told, by staffers, by members, that they know there's more to do and they want to do it. And so the biggest thing that I think to do is to come in, and we always come in kind of with our hand out, with questions, with asks, with everything that we need. So to come in and say thank you, first and foremost, thank you for all that you've done. Thank you for the help that you've given. It's going to have an impact. It's going to help. And here's what's next is the perfect lead-in, because they want to know that they've done their job well. And
Exactly.
I mean, Congress hasn't been exactly efficient in the last couple of years. We've gone down in the amount of bills that have been passed overall. It is drastically reduced in the last year. And so for us to have gotten anything over the finish line is huge. And for them to know that they've made an impact in their community helps.
And, Congress probably hasn't gotten a lot of thank yous this year, so it's really nice to lead with a positive.
It's very nice to lead with a positive. They appreciate it more than I can tell you. It is very helpful for what's coming next to know that they are appreciated and what they did is helpful. And so I would say lead with that, and then they're going to say, all right, but what did we leave out? Like, what's next?
Right. And one of those areas is Medicaid
Yep.
managed care reform. What can you share with us about that?
So our Medicaid managed care reform fell out for a myriad of different reasons. We're currently working on some of that, but it is a main priority. A lot of it was just timing and getting things into a bill last minute. It takes a lot, and one small thing can derail an entire section, which is kind of what happened with us. And so when we got the phone call and they said, hey, Medicare is in, we can't get Medicaid in the next 48 hours, we're going to work on it. We want to finish it. That's what we need to remind everyone of, hey, you promised, this almost made it in. It's a hugely important deal. It needs to get across the finish line in something. And it is an election year, which means there are fewer opportunities to add something to a bigger, broader package. And we don't love the timeline right now, but we're looking at potentially the appropriations bill at the end of September, or, something this fall with a healthcare extenders package, because there is always a healthcare extenders package at the end of the year. If we can get something into budget reconciliation, if they do end up doing budget reconciliation this year, we'll try. I've heard, I would say 99 million different rumors on if it's coming or when it's coming or if it can get passed. And there's also the opportunity to do a standalone or a separate healthcare package. But the closer we get to election, the less that folks are going to want to work together to pass something. It's really either the beginning of the year or after an election year or after the election in an election year, just because they've got to appeal to their base because they want to get reelected to come back.
So when you talk about Medicaid managed care reform, obviously reimbursement is a big part of that, but there are other things as well.
Yes. So the Medicaid piece that we have introduced several times, almost gotten over the finish line, it would eliminate spread pricing and move to just a set rate that PBMs have to follow. Not quite the same bona fide reimbursement fee that is in, or the bona fide fee that is in Part D, but basically the same thing, just slightly different terminology for a different program. And so they would move to a flat rate fee that is determined, and it would save money there, which is where a lot of our savings would come from in this program. And then it would also require NADAC, so the National Drug Acquisition Program that everyone has been putting into. It would make it mandatory. And so you would have to, when you are called on, turn in what you need to on the pricing that has been going on in your pharmacy, what you've been getting the drugs for. And then you would be guaranteed your state's Medicaid fee-for-service dispensing fee. And so we know that there's going to be a little bit of a cost adjustment with everything that's going on with reimbursements when NADAC does go into effect. But that state's fee-for-service Medicaid dispensing fee should really, really help everyone. And there have been states who have already implemented this to, great renown. We've seen states that it's really helped for the folks out in there, and we want to make sure that we can have that for everybody. And so we're trying to just make it a federal baseline to spread the love.
So when you look at that fee-for-service across all the states, it's by and large pretty adequate then, right? Would you say?
Yeah. I would say so from what we've heard. It does then put the onus a little bit on the states, because when NADAC was created, they did not mandate a certain update of the cost dispense studies. And so we're going to be working on that on the state level. We tried to get that in at the federal level, but we got a lot of pushback from CMS, unsurprisingly. And since they have to sign off on a lot of the legislation and tell us and Congress, in all reality, what is and isn't feasible and doable, we have to listen to them a little bit. And so this is where we will be taking that fight on getting updated cost dispense studies and ones that will be helpful to the state.
Right. So is there also a patient steering component to this legislation?
Not in this one. That
Okay.
is one of the things that did fall out in the big push over the last couple of years. Kind of, I don't want to say it's because we had opposition, because it's not. It's really because of an unforeseen set of circumstances. But then once you get things packaged up and rolling nicely, adding things back in is a little harder. But that's one of the things looking forward that we're really going to be pushing. We need Medicaid over the finish line, but we're also working with other offices on new pharmacy provisions, what's coming next, and moving forward into the next iteration of big pharmacy priority legislation. And patient steering is one of the things at the top of the bucket.
Because I know that's a big concern on the part of a lot of pharmacies.
It's a huge concern, and I should hopefully have draft legislation that we're working out with an office get ironed out here soon to be reintroduced in the next couple months.
So another thing we've been hearing about is something called Patients and Monopolies. What can you share with that? And I know that initiative kind of started in the States, I guess specifically Arkansas, which
Yeah. So this one was interesting. In December of 2024, Elizabeth Warren, Senator Warren, Senator Hawley, Representatives Harshbarger and Auchincloss introduced the Patients Before Monopolies bill. It came at an interesting time right after the United Health CEO had been killed.
Killed.
Yeah, that's the best way
Right.
that I can say it.
unfortunately. Right.
Unfortunately. And there was just so much pushback during that time that this legislation was born out of all of the stories that members and senators were hearing and what could they do to stop what they're seeing. And one of the biggest ways that they could figure out how to do it was maybe let's break up this vertical integration that hasn't been helpful. We have seen it increase costs. We've seen it do all these other things. For years, folks thought it was going to help, and it turned out it was doing the exact opposite. And so that bill was introduced in 2024. It then made its way out into the states. And so Arkansas saw that, picked it up, ran with it, loved it. And they got it passed at the state level. Arkansas was the first state to do it. We've had other states who have taken it up, are pushing it through their legislatures right now. And we're hoping that there's more to come out of it. It is going to be reintroduced to this Congress at some point. I will say that Senators Hawley and Warren expanded out on this a little bit. And so when the insurance CEOs were in town a couple of weeks ago, they introduced the Break Up Big Medicine Act, which is similar but doesn't touch our pharmacists as much at all. And so we are working with the Warren team to get everything lined up again. We need one or two more members to hop on to lead. Specifically, we need some Republican members in the Senate and the House
Right.
because they're trying to do this as what we call a Noah's Ark or a 2x2. They want to make sure that it is extremely bipartisan. So if we have one D and one R, we need to make sure that we just keep adding them on in pairs the whole way down because we want to show that this is truly a bipartisan effort. And so that's going to be one of the things that we will be pushing during fly-in is
Good.
looking to the future of what's next for pharmacy and what's next for healthcare and for patients, and not allowing PBMs to own the pharmacies is one of the big
Huge.
things that we could really make achievements on. And so we're going to hope for that.
So obviously we've got a lot to talk to members of Congress about, and we certainly hope everybody that wants to come to fly-in is able to. But for those that aren't, what are some things that they could be doing at home? What's the plan for sharing information with them?
So we will be sending out messaging and grassroots to folks who can't attend or aren't here so that they can send messages that'll be very similar to what we are sharing on the Hill on some of these issues and a little bit more, so that they can reach out and say, these are the priorities that are important to us and get the message all across at the same time. Beyond that, we've got a couple opportunities of what we call congressional recesses coming up. Looking right now, we're in the middle of the Easter recess. If at this point they haven't called them all back to maybe finish the DHS funding. But there's going to be more for Memorial Day, and then looking forward to June and July, there's going to be lots of opportunities to ask your members to come and see you in your pharmacy. And so if you think that you would like to have a member of Congress come and learn what's happening in your pharmacy, we're more than happy to reach out to the office, try and set something up, have you guys reach out. We've got lots of resources for this, and it truly is one of the most impactful things. So to have any of our pharmacists who can't come either call, email, or invite their member out to tell them about what their issues are, it's huge.
I'm glad you mentioned that, and NCPA can certainly help set that up. Well, thank you for being on the podcast, our first foray into live podcasting in the new studio, and I hope you have a great Easter.
You too. It was great to be here. I'm excited for this new format and excited to see everybody at Fly-In.
Yeah, thanks.
Thanks, John.